Hi. Okay, we're gonna try and do this again. Hopefully it works. Apologies for the mess in the back. But this is a 47-year-old male who had an open cholecystectomy. I'm assisting in the closure of this wound after surgery. Healthy male on Zocor for hypercholesteremia. Okay, so let's jump right in it. The indications for closing a wound with sutures is that it has to be a clean wound with minimal skin loss. We secure the drains if we want. That's one. If we want to secure drains or lines so that we don't lose them. If we're doing an operative closure, which is the case, my case right now. Contraindications. If there is a laceration through infected skin, meaning if it's cellulitis, if it's deep puncture wounds, if the laceration has been contaminated with a lot of debris that cannot be removed without irrigation or debridement. Most animal bites are contraindicated with sutures. If it's a facial laceration, we are going to defer that to a plastics and or somebody veteran or more seasoned. And we're going to avoid closing a wound with significant skin loss. Okay. The safety precautions. An alternative, we could mention alternative options if we are discussing primary versus secondary intention. We're not choosing secondary intention because this is not an open, dirty, jagged wound. The margins are very well delineated. This is a sterile site. So we're choosing primary intention over secondary intention. We're choosing it to close it from the top, bottom, not bottom. Actually, well, not bottom up in the sense of like natural granulation, but I'll get to my technique. We're gonna use steri strips on top because I'm doing subcuticular. As far as Lida with epi or without, the patient's sedated, so it's irrelevant. And then as far as tetanus, it's not in the patient's history, but let's assume the patient's up to date with the 3 vaccines. This is a clean wound. If it's been more than 10 years, then yes, we'll give a tetanus shot. And as far as antibiotics, we're going to have cefazolin infusing during the procedure. Okay, these are my gloves. For the sake of time, I'm not going to put them on. I've already loaded the needle and I've already done my first knot inside. I am doing a subcuticular suture technique with steri strips on top. This is a 4O monocrystal monofilament. We want it to be absorbable. We want it to be synthetic, not natural, to avoid any infections. And a monofilament, not braided. Yeah. Okay, let's go. So I've done a deep suture with 5 throws. Then I'm going to do a back-ended knot into the apex of the laceration, and then we are going to go to the sides. Sorry. I've very much used this pad, so let's hope it holds. And like I said, this is a sterile procedure because we are in a operating room. The patient will likely not be needing prophylactic antibiotics orally. getting some pretty big bites. We're not going to do Dermabond because Dermabond cannot touch mucosa. And it is very much approximated, as you can see. Showing you my technique right here. Almost done. We're gonna go one last side. Like so. Okay, then we are going to do a deep bite at the end of it. The other end of the apex. Sorry. To close it. And then we're doing it away from me and then towards me. We'll probably do like 5 throws. For the sake of time, we're only going to do a few. Cut this close. And then we're going to go the other end. Again, looking towards me. It broke, sorry. But it's supposed to go to the other end. And that's it. This is my sub-Q. I would put steri strips on top. Thank you.